And the police news counting from today on Dr. Fernando Vieira Filho, clinical psychotherapist. Doctor, they gave us a question here. Can suicide be an effect precisely of depression?
Exactly. Have you seen Faria? All suicidal people are depressed. He is suffering from depression. There are many people, for example, who commit suicide when they suddenly stop taking medication, which we call the rebound effect. So this is very important. See, Farina? Warn your viewer if you are undergoing treatment for depression, if you are taking medication, such as sertraline, paroxetine, which are the most common, fluoxetine, do not stop medication without medical authorization. Because to stop these medications, you have to follow a process that we call weaning. The person has to wean off the drug gradually. Because suicide usually occurs in the rebound effect. The person stops varying. What happens? The symptom of depression comes like a tsunami, breaking the person. The person cannot stand it and often commits suicide. Now, not every depressed person, of course, is going to commit direct suicide. No.
What are the symptoms of a depressed person?
The first symptom is when the person loses, let's say, their purpose in life. Generally, these people who have depression are people who don't know how to say no to anyone. They are those nice people who say yes wanting to please everyone. They are people who are often sad. That sadness that you don't know where it came from. That thing, you don't get out of bed, you don't shower, you don't want to work, you don't want to go out. Now, as I was telling you, Fally, there is depression that is normal, which we call reactive depression, which is that depression that results from natural facts in the life of human beings.
A job loss, a loss of love.
From a relative. A loved one. Yes, the entity, for example, dies. A father, for example. I mean, the person has that relationship with the father. It's natural for him to be depressed. We call this depression reactive depression, which the person can bear without the use of medication, many times. And just like I was saying to you, the period usually lasts 1 to 2 years. For similar person, in fact. That's normal. You have a job there for 30 years. Suddenly you are replaced by a young man. Go to the street eye. Many times you go into depression. Can retirement also happen? Because many times a person has a high position and suddenly retires. And the loss of that power she had, that importance she thought she had, okay? Having that position, that there also generates the person becomes depressed, sad.
What would be good to solve in this case?
In the case of retirement, what we recommend is the following. Usually the person who retires already has a profession. If he has a profession, he blinds that profession. Or you have a hobby, you will follow the hobby and sometimes you will earn a lot of money from that hobby that you have.
It's because we observe this, that sometimes when people retire, the first quiet month, it's almost like a vacation, right? Then comes the second, the third, and the person really starts.
It starts to feel bad. It starts to feel that something is wrong. Is she missing something? The purpose of life. So a person can never lose their purpose in life, their direction, what they want in life. You understood? So if you think you don't have it, look for a life purpose. As many times, the subject, for example, is a judge. He retires, he's going to lose that power overnight, judge. And then he often goes into depression. And what we recommend is this. The guy divulges again. And if he has that depression over there, what do I recommend for that guy? I say, my friend, you're back, you have a very good salary. Go public again and go to help the poor, because every poor person you help you will see the satisfaction you will have.
That is, the social work that ends up raising a person's self-esteem.
By the way, Chico Xavier was something he recommended when people came to him complaining that they had depression. Chico used to say, go to the periphery, go there, go to the periphery and talk to the people there who are having difficulties. Then you come back here and tell me how your depression is. I mean, he knew Chico that the fact that the person does charity, I mean having a purpose in life already helps to work on that depression.
Okay, well, so just remembering that every Monday Dr. Fernando Vieira Filho will be here with us, clinical psychotherapist, Look at today's program. It's really fantastic. It's very important because we'll bring it here. We'll be presenting, discussing, commenting on cases there that can really affect everyone's life. We are so very important there. Every Monday he will be here with us, and those who want to participate can send their messages, their questions, any doubts about personal behavior. Very important in the day-to-day of our society, and sometimes certain situations arise unnoticed, but which we will be commenting on with the presence of Dr. Fernando.
Doctor.
Fernando, it was a pleasure to have you here at the Police Noticia every Monday here with us.
Pleasure is all mine, very, and a big hug for your viewers and the internet too.
So there is the participation of Dr. Fernando Vieira Filho, clinical psychotherapist. And we also show some of the movement in the last 48 hours, 24 hours, with the Copom 190. By the way, another very violent weekend here in the city of Uberaba. Until the next police news, always with information from the police area.
Until then.